Hello everyone! Now, if you have been paying close attention to the number of COVID-19 deaths recently, you will find approximately 90 to 100 patients who are brought in dead into the hospital every day, or in short, BID. Now, this data is a worrying trend, especially now when the country's medical system is overwhelmed with so many cases. Milder cases will need to be isolated at home, but because of a lack of awareness of warning signs, there is an increasing trend of patients being brought in dead. Now, in fact, these deaths can be avoided. Today, if you or your family have contracted COVID-19, this includes both the vaccinated and unvaccinated individuals. What should you do and what does it mean to self-isolate? Now, the first thing, if you are diagnosed with COVID-19, is to stay calm and carry on. Putting the cliche aside, from the time you are diagnosed with COVID-19, what you do from then on is very important. If you start planning how to isolate at home, there is a possibility that you can protect the people around you from getting the infection. You will also be able to navigate better the challenges you may face over the next 10 to 14 days of home quarantine. So what does it mean to self-isolate? For one, you need to have your own room and an attached bathroom if possible. The room should at least have some windows to maintain air circulation. Now, if you need to share the bathroom with other members of the same household, both parties will need to wear masks when you go out of the room. After using the bathroom, clean and disinfect door handles, taps, toilet seats, and other contact surfaces. Now, there have been some doubts about the period of home isolation. Generally, it is 10 days for most individuals, but the days can be extended to 14 days if the patient is highly symptomatic. During this time, it is forbidden to have guests visiting you. Needless to say, you shouldn't be out shopping or going to work. This is by all means not a punishment. It does not mean that you stop contacting the outside world. In fact, it is very important to stay in touch via your mobile phone. With this, you can talk to family, friends, or send a report to the COVID assessment centers. You will also need to prepare your own cutleries and medicine, which includes both your usual medication if you are taking any, and paracetamol. Next up are some of the equipment that you will need to prepare when you self-isolate. During self-isolation, you will need to fill out a symptom checklist on a daily basis. So it's important to have a pulse oximeter, which is approved by the Medical Device Authority to measure your oxygen saturation, and a thermometer to measure your temperature. The measurements should be done at least 3 times a day. Now, of course, when you are feeling sick, you may be too ill to do anything, such as preparing your meals, washing your clothes, getting rid of the trash, while ensuring you get enough rest. So it helps to have family members or caregivers around who will be able to take care of your needs. Their responsibilities are extremely important. To this, we now turn. It's important for caregivers to know how to deal with laundry, food, and trash. Now, firstly, the caregiver who is a close contact would also need to stay at home for 10 days. Their job includes preparing a balanced meal for you, putting the meal outside of your door, then moving away, allowing you to open the door to bring in the food on your own. Remember not to share the leftovers. You should also have some plastic bags ready to put your swab clothes and trash. Back to the caregiver. When you wash the clothes, do not mix the clothing of the infected patient with other family members. Wash them separately. When dealing with dirty clothes, put on a mask and gloves. Try not to shake the clothes as you are removing them out of the plastic bags, as this will cause the virus to disperse into the air. It is enough to use ordinary washing powder, but preferably you should wash with hot water around 60 to 90 degrees Celsius, because at these temperatures, the virus will be eliminated more effectively. After doing the laundry, remember to throw away your gloves and mask and wash your hands. Dry the clothes under the sun. Now, is there a proper way to dispose trash? Obviously, the answer is yes. The patient needs to put all the trash into a plastic bag, tie it up firmly and put it outside the door. The caregiver needs to put on a mask and gloves, place the first plastic bag into a second plastic bag, tying it tightly before discarding it. Remember to wash your hands afterwards. Now here comes the more important bits. During home isolation, you need to be able to know what are the potential warning signs that you may encounter. Most patients will be completely asymptomatic, or they may have some mild symptoms. However, some people may deteriorate quite rapidly from the 8th to the 10th day. Happy hypoxia is one such encounter, and it's one of the potential reasons why there are more patients who are brought in dead to the hospitals. Whether you are asymptomatic or have mild symptoms, it is best to have a pulse oximeter at hand in order to measure the oxygen saturations in your blood. If your pulse oximeter shows an oxygen saturation of less than 95%, ding ding, this is a red flag. So here are some steps to use a pulse oximeter correctly. First, put your index finger into the pulse oximeter. The nails should be in contact with the infrared rays inside at all times. Remove nail lacquers. Next, look at the display monitor. The display must show a regular waveform, only then will the test be accurate. You will see two indicators on the monitor. The first one shows your oxygen saturation. A normal oxygen saturation should measure 95% and above. The one below is your pulse rate. A normal pulse rate should measure 60 to 100 beats per minute. Now, if you want a more accurate test, a simple sit-to-stand test can be used. Here's how. Step 1. Sit upright in a chair. With the pulse oximeter, record your oxygen saturations and heart rate at rest. Step 2. Stand up and sit down repeatedly on the chair, as fast as you reasonably can for 1 minute. Step 3. After 1 minute, measure your oxygen saturations and heart rate and jot it down. If you have noticed that your oxygen saturation falls below 95% after the 1 minute sit-to-stand exercise, this means something could be potentially wrong. Now let's talk about other more visible warning signs. The most common, shortness of breath. Now, this breathlessness is not the typical breathlessness you feel after a bout of vigorous exercise. It is the type that you feel whilst you are taking the usual 2 or 3 steps to the bathroom. You may realize it gets harder to breathe than usual. Some people even experience a form of chest tightness. Now, some of you may ask, what about preparing an oxygen concentrator to stand by at home? Should I get one in case I have difficulty in breathing? You may have noticed I did not include it in the list of equipments you need earlier. My answer is, this is not necessary. There is a difference in the oxygen content that the oxygen concentrator is able to supply versus what the hospital can provide. In an emergency situation, the oxygen provided by a concentrator may not be enough. A more valid reason is, by the time you require oxygen, you would already be experiencing a Category 4 COVID pneumonia. What you will need at this point of time is medical attention, prescription drugs such as steroids and anticoagulants, and close observation in a hospital setting. But you may say, what if there are no beds? In fact, many quarantine centers have recently been converted to field hospitals equipped with medical equipment, oxygen, with some even having operating theaters and ICU. Hopefully, this will help reduce the clog at our major hospitals. Other warning signs to look out for include feeling drowsy or unconsciousness, lack of appetite, vomiting, diarrhea, and even symptoms of dehydration. If you experience any of these warning signs, do not delay. Contact the COVID assessment centers immediately or dial 999 or get a family to drive you to the nearest emergency department. Finally, if you are able to recognize the warning signs above, in addition to using a pulse oximeter correctly, I believe you'll be well equipped to handle whatever comes your way in this period of self-isolation and home quarantine. So that's all we have for this episode. Let me know what you think in the comments box below. And if you found this video helpful, do share it out with your friends. Till we meet again,